Hi, I'm Dr. Rashmi Yogish, Consultant Fertility Specialist at Khushi Fertility IVF Center, Bangalore. When does one resume sexual activity after having had a cesarean section? This is a very commonly asked question. Most of the times, we ask women to avoid intercourse for at least 6 weeks post a C-section. However, there's no fixed timeline for the same. We see that most women avoid sexual intercourse for at least 3 months post C-section. Why the timeline of 6 weeks is told is because usually there would be a discharge called lochia that comes from the vagina, and this continues to happen till the uterus completely involutes. The lochia is initially bright red in color, then it becomes dark red, pale pink, then yellowish. Finally, it stops after being like a sticky mucoid white discharge for a couple of days. Usually, the cessation of the lochia is a marker of the uterus coming back to its normal shape as how it used to be before pregnancy. This also is an indicator of the uterus scar healing, and that's the reason why we say women should avoid intercourse for at least 6 weeks post a C-section. As long as the lochial discharge continues, the cervical canal continues to be open, and therefore having intercourse when the lochia is still ongoing could increase the risk of infection. And if the uterus scar is healing slowly, especially due to metabolic conditions like diabetes or autoimmune problems, there is a chance that the healing could get hampered due to infection. And that's the reason, the timeline. However, there are a lot of questions around what to do in case one continues to have the lochial discharge for a prolonged period of time. And so the most important thing is one should see an obstetrician not only a week or two after the C-section for a routine checkup to understand how the wound is healed, but also after 6 weeks. This will ensure that the wound is totally healed, the lochial discharge is totally stopped, and there's no infection that is there. And this will also give insight to the lady to understand if she can resume sex or not. There are a lot of misconceptions about having had sex before 6 weeks. A lot of women get scared if at all they have sex before 6 weeks. There is nothing to be worried, but however, there are reports that women can get pregnant even 3 weeks after a C-section if they've not used protection. So the only risk would be risk of pregnancy, and that's the reason why we would ask women to avoid protection every time they have intercourse after having had a C-section, if at all they have not resumed their periods. When women resume intercourse after C-section, they also face a lot of practical problems. The scar of the C-section takes about 4 to 6 weeks to heal, and during this time, women can experience faint pain at the site of the scar, and most of the women have tingling and numbness around the area of the scar for about 8 to 10 weeks. Most women also experience anxiety, postpartum depression, postpartum blues, and the subconscious stress of the child waking up is another thing that remains at the back of their mind, and that makes the entire act quite stressful and difficult. They also have sleepless nights and anxiety of the newborn, as the time to adjust to motherhood is a phenomenal thing in a lady's life, and adjusting to motherhood is actually a monumental change in a woman's life. It gives them a lot of pressure regarding how to take care of the child, and therefore the interest towards having intercourse comes down. We've seen that a lot of women complain of vaginal dryness while having intercourse post C-section. This is also because of a lot of hormonal changes that happen in the body and due to reduction in the level of estrogen that happens during breastfeeding phases. And we would advise such women to use lubricants that will help them ease out the pain. Apart from that, a lot of women also have the concerns regarding the positions that they should use while they start having the intercourse after having a C-section. We see that most of the normally used positions like missionary position and positions like standing can cause some pain at the site of C-section, and therefore positions like the woman being on the top or the side-to-side positions would be recommended. However, the best thing would be to resume intercourse once they are able to have intercourse in the missionary position or the position that they were having before without experiencing any pain. Some of the women, we tell them to start doing the Kegels exercise soon after the C-section, maybe after about a week or so. And most of the times, the Kegels exercise, people think are exercises to be done only after a vaginal delivery. But the most important thing that women have to understand is that Kegels exercise is not just for the vaginal muscles, it is for the entire pelvic floor. And therefore, even after a C-section, it is very crucial that women start doing Kegels exercises to strengthen their pelvic floor muscles. This will prevent things like stress and continence that can happen after a pregnancy as such. And so we ask them to start doing Kegels exercises. Most of the women complain of slight discomfort or pain when they do Kegels exercises, and we ask them to ignore the slight discomfort they have and continue to do it. When a lady can do up to 100 Kegels without having any discomfort or pain, that shows that the soreness in the pelvic floor muscles has all reduced, and there's also probability that the uterine scar is also healed well, and that is when is the right time for them to start resuming the sexual activity.